Together we achieve victory over heart failure.
Hello, my name is Dr. Kislay Shrivas. I am cardiologist in Bhopal. So today I would advise you regarding monitoring your heart failure condition and regarding evaluating the numbers and vital signs. How do we know that? So this is a very critical aspect of healthcare. Monitoring heart failure condition. It's very difficult to notice heart failure right away. As our heart faces increased strain, it compensates by working harder. Yet, as heart failure progresses, its ability to pump blood diminishes gradually. So over time, what happens is the subtle changes that go unnoticed, emphasizing the importance of recognizing heart failure symptoms, and those can progress further in the future significantly. So swelling in the feet, ankles, abdomen, along with sudden weight gain are common signs of heart failure. So monitoring weight can also help in managing the swelling and identifying the heart failure and shortness of breath during daily activities. So all those new signs that you might find that you are having, so those might be the indication of heart failure. Interruption in breathing due to persistent coughing, wheezing patterns, and difficulty in sleeping. This might indicate heart failure. Fatigue, confusion, fainting, and other symptoms are like rapid heart rate, nausea, or lack of appetite could also indicate heart problems. So if you notice any of these signs, seek prompt medical care. Let us discuss about key heart numbers. So what is blood pressure? So blood pressure is high harmful. Obviously, high is harmful. Low is harmful. Yes, it can also indicate some problems. So high blood pressure is definitely harmful because it makes the heart work harder and less efficiently. So it can be detected easily. So this is something we can control. So what is the elevated blood pressure? So above 120 and 80. So that is systolic and diastolic BP for you. So that is significantly elevated blood pressure. So how much is too much? So well, that depends on age and many more things. But you can easily say if it is below 120 and 80, then it is important for you. So now what about cholesterol level? Obviously, so cholesterol is very important. So what happens with the cholesterol deposits in the artery? It form deposit in the artery, reducing their flexibility and also cause the athermatous plaque, which can rupture and cause the coronary artery disease and ACS. And it doesn't, it will still reduce the flexibility of the arteries. So normal or healthy level of cholesterol, these are very different data. So sometimes the new guidelines that have come up with the CSI, so they say that you should get yourself evaluated early for lipid profile. If there is any significant family history, so you should get yourself evaluated by 18 years of age itself. So why? Because this is the time you can protect yourself. So LDL cholesterol ideally should be less than 100 milligrams and HDL should be more than 45 to 50 milligrams. So this is for younger people. And as the age increases, the value does change. And if you are diabetic or hypertensive, then obviously values are very different. So, and what about heart rate or pulse? So heart rate is number of times your heart beat per minute. So very increased heart rate is a problematic thing, and very slow heart rate is a problematic thing. And below 60 and above 100 is obviously bad. So in the athlete itself, it might be even lower till 45, 50. So it depends on the physiology and what conditions you are having. So, and we should always strive for achieving a lower heart rate than a very high heart rate. So when you are exercising, you should keep your heart rate somewhat in the range of less than 140 or less than 150 according to the age, so that you prevent yourself from suffering from any cardiac acute coronary syndrome. So this to concludes today discussion on monitoring heart failure condition and advice about acute coronary syndrome protection. Thank you very much.